Join me as I take on the challenge of uncovering the signs of Alzheimer's disease and see if I have a time bomb ticking away. Alzheimer's disease is a complex and debilitating condition that affects millions of people worldwide. But despite its prevalence, there's still a lot we don't fully understand about it, especially when it comes to identifying risk factors. Today, we're going to explore the connection between your health profile and Alzheimer's disease risk. As we age, our bodies undergo a range of natural changes that can impact our health. But did you know that some of these changes can also increase our risk of developing Alzheimer's disease? Understanding your health profile can give you valuable insights into your risk factors, helping you take proactive steps to protect your brain health. From high blood pressure to high cholesterol, many common health conditions can contribute to an increased risk of Alzheimer's. But it's not just physical health, our mental and emotional well-being can also play a significant role. The more we learn about Alzheimer's disease, the more we realize how important early detection and intervention are. By understanding our individual risk factors, we can take steps to mitigate them and potentially delay or even prevent the onset of the disease. One of the biggest challenges in identifying early signs of Alzheimer's disease is that it can be incredibly subtle. In many cases, the symptoms are so mild that they can be written off as just a normal part of aging. But the problem is that by the time symptoms become noticeable, the disease has often already progressed significantly. Early detection is critical in Alzheimer's disease management. It can make all the difference in getting timely treatment and slowing down the disease's progression. But how do you identify those early signs? That's what we're going to explore in this video. Imagine if you could identify your risk factors early on and take proactive steps to reduce them. Imagine being able to delay or even prevent the onset of Alzheimer's disease. It's a game changer, and it's exactly what we're going to talk about today. Alzheimer's disease doesn't just affect the individual, it also has a profound impact on families and caregivers. Watching a loved one struggle with memory loss, confusion, and mood changes can be heart-wrenching. But what if you could take steps to reduce the risk of that happening? In many cases, Alzheimer's disease is a slow-moving process that can take years to develop. But that also means there's time to take action and make a difference. By understanding your health profile and identifying risk factors early on, you can take proactive steps to protect your brain health. Identifying early signs of Alzheimer's disease is a complex process that requires a combination of medical expertise, cutting-edge technology, and good old-fashioned detective work. But it's not impossible. With the right tools and knowledge, you can take control of your brain health and reduce your risk of developing Alzheimer's. So, what are the early signs of Alzheimer's disease? Well, that's what we're going to explore in the next section. From memory loss to cognitive decline, we'll dive into the various indicators that could suggest an increased risk of Alzheimer's. Genetics play a significant role in Alzheimer's disease risk. If you have a family history of the condition, you're more likely to develop it yourself. But what if you don't have a family history? Are you off the hook? Not necessarily. Researchers have identified several genetic markers that increase the risk of Alzheimer's disease. These markers can be inherited from our parents, and they can significantly impact our risk of developing the condition. But genetics are just one piece of the puzzle. Our lifestyle choices can also have a profound impact on our Alzheimer's disease risk. From diet and exercise to mental health and social connections, there are many factors that can influence our risk of developing the condition. Let's talk about diet. What we eat has a direct impact on our brain health, and a diet rich in fruits, vegetables, and omega-3 fatty acids can help reduce our risk of Alzheimer's. Exercise is another critical factor in Alzheimer's prevention. Regular physical activity has been shown to improve cognitive function and reduce the risk of dementia. But it's not just about physical activity, mental exercise is also crucial. Mental health is often overlooked when it comes to Alzheimer's disease risk. But the truth is that chronic stress, anxiety, and depression can all contribute to an increased risk of developing the condition. Social connections are also vital in reducing Alzheimer's risk. Studies have shown that people with strong social networks are less likely to develop dementia. Chronic inflammation is another key factor in Alzheimer's disease risk. When our bodies are constantly fighting inflammation, it can lead to cognitive decline and increase our risk of developing the condition. Sleep is critical for brain health, and chronic sleep deprivation can increase our risk of Alzheimer's disease. But what if you're not getting enough sleep? Vitamin D deficiency has been linked to an increased risk of Alzheimer's disease. But what if you're not getting enough vitamin D? Hormonal imbalances can also contribute to an increased risk of Alzheimer's. As we age, our hormone levels change, and this can impact our brain health. As we explore these various health indicators and lifestyle factors, it's clear that reducing our risk of Alzheimer's disease is a complex process. But it's not impossible. Meet Sarah, a 55-year-old woman who was concerned about her risk of developing Alzheimer's disease. Her mother had died of the condition, and Sarah was determined to take proactive steps to reduce her own risk. Sarah started by making lifestyle changes. She began exercising regularly, eating a healthy diet, and getting enough sleep. She also reduced her stress levels by practicing meditation and yoga. But Sarah didn't stop there. She also started to prioritize her mental health, seeking out therapy to deal with chronic anxiety and depression. Sarah's proactive approach paid off. She reduced her risk of developing Alzheimer's disease and improved her overall health and well-being. Sarah's story is a powerful reminder that early detection and intervention can make all the difference in managing Alzheimer's disease risk. In this video, we've explored the complex connection between health profiles and Alzheimer's disease risk. We've delved into the various health indicators and lifestyle factors that can contribute to an increased risk of developing the condition. But the most important takeaway is this: you have the power to take control of your brain health. By understanding your health profile and identifying risk factors early on, you can take proactive steps to reduce your risk of Alzheimer's disease. Thanks for watching, and don't forget to share your thoughts in the comments about your own health journeys. What are you doing to take control of your brain health? And so if you found this video helpful, please like, subscribe, and click on the bell for more health tips and updates.